Good morning, everybody. I hope you guys all had a great weekend. We are going to jump right into chapter 7 today. This is going to be the last chapter that we have before our midterm exam. So as a reminder, make sure you guys are all getting your quizzes done. Chapter 4, not chapter 4. Quiz number 4 is coming up and should be due. And now quiz number 5 is also open, which covers chapter 6 and 7. So make sure you guys are looking over these and let me know, obviously, if you have any questions. On Wednesday, we will be meeting virtually live. Okay, so we'll be reviewing for your exam next week. So make sure you guys are coming with any questions that you have. Okay, so we are going to jump right into chapter 7, which is all about shock. So shock basically occurs when the body tissues do not receive enough oxygen-rich blood. We know if body tissues do not receive blood and oxygen, eventually those body tissues die. So shock, also called hypoperfusion, describes a state of collapse and failure of the cardiovascular system in which blood circulation decreases and it eventually ceases, okay, meaning it eventually stops. So perfusion is an adequate amount of oxygen provided to all cells in the body. So everything is working properly. So you guys have to remember that that's perfusion. Hyperperfusion, like I just said, is basically considered shock. Okay, so the cardiovascular system fails and blood circulation eventually ceases. As we chatted, obviously, if certain areas of your body do not receive blood, they do not receive oxygen, they can die. So within 4 to 6 minutes of not receiving oxygen, the brain tissue can die. Within 45 to 90 minutes, abdominal organs can fail. And then also within 3 to 6 hours, skin and muscle cells can die. So we see that if somebody does go into shock, it is absolutely necessary that EMS is called and we receive further care, and we have to make sure that we treat it properly so we do not have death of important tissues. Okay, when we think about shock and how the body works, we need to think about it as a perfusion triangle. Okay, so this is going to be on your exam. It's also on your quiz. So you have to think of the circulatory system as having 3 components. Okay, so we have the heart, the blood vessels, blood fluid. Okay, we know the heart pumps the blood out. The blood vessels are somewhat like the pipes. They carry the blood, and the blood is actually the fluid that is carrying nutrients and also oxygen. So if you guys see, this is somewhat the perfusion triangle. So make sure you are looking in your book. It has all of these charts for you guys and makes everything super, super simple. So after you view this PowerPoint, make sure you are going back and you are reading your chapter, which is pretty short, along with looking at all of the charts that you guys have, okay? So there are different causes of shock. Obviously, there are cardiovascular causes of shock. So this is basically the pump failure. This is called cardiogenic shock, okay? You can also have a loss of fluid or blood. That's hypovolemic shock or hemorrhagic shock. I don't know. I always have such a hard time saying that name. So you have to understand that there are cardiovascular types of shock. So make sure you review those and look at all these charts. All right, moving along. So there's also poor blood vessel function. Okay, that's going to be called neurogenic shock. Okay, so this could happen if you have a spinal cord injury and the nervous system isn't working properly to control blood vessel size and muscle tone. Okay, so that could be the cause of neurogenic shock. Also, that all combined, it can be, I'm sure you guys have all heard of septic shock. This is basically when someone has a severe bacterial infection and this produces toxins. The toxins would then damage vessel walls, causing them to become leaky and unable to contract, okay? So we see that this is septic shock. Oops. There are also non-cardiovascular forms of shock. So we have respiratory insufficiency. Okay, so these can be things like chest injury and injuries to your lungs, an airway obstruction if somebody is choking. And then I'm sure you have all heard of anaphylactic shock, which is basically a severe allergic reaction. Okay, so this can come from medications, food, insect stings, things like that. So insect stings, think of bees, things of that nature, food. Some people are very, nut allergies can be very bad and cause anaphylactic shock as well. So those are the types of things you need to think about with that. Psychogenic shock is basically fainting or syncope. So what happens is when something happens, your blood vessels dilate and it takes all the blood away from your brain and oxygen, and you temporarily pass out. So this can be caused by fear, bad news, unpleasant sights if you see a lot of blood, even if someone were to vomit, things of that nature. Sometimes it sits very differently with a lot of people. I don't know if any of you guys have ever actually experienced fainting. I have not, but that's what psychogenic shock would be considered. Okay, there is a progression of shock. So there's compensated shock, decompensated shock, and irreversible shock. So compensated shock is the early stages. So if you look over here into this chart, it's going to be things like agitation, anxiety, restlessness, your skin might be pale, nausea, shortness of breath. Decompensated shock is already that later stage of shock. So at this point, you already have difficulty breathing, dull eyes, dilated pupils. Okay, this is becoming very, very serious at this point. Irreversible shock is basically death. Once you get to that point, like the word says, irreversible, you cannot go back. Okay, so we need to make sure that it is treated properly at the compensated stage as well as a decompensated stage. Okay, so things to look for in shock. Shock itself, you're not going to be able to pick up, but you're going to be able to pick up the warning signs and symptoms of shock. So things like altered mental status, maybe somebody's confused, or the light's on, nobody's home. You can look at somebody, you know that they're conscious, but they're very confused with what's happening. Pale, cold, and clammy skin. If they're starting to sweat a little bit, they're not getting enough oxygen. Pale lips and or nail beds. Again, we're not getting oxygen. Nausea, vomiting, rapid breathing, heart rate, unresponsiveness when shock is severe. So that unresponsiveness when shock is severe, now you know that you are in that later phase of it. Okay, so you're in the decompensated shock phase. Okay, what we should do when we encounter shock, obviously treat injuries. If you see that individual and they have any injuries, you must treat that first. If they are responsive and breathing normally, you can keep the person flat on his or her back. So just like this image, and normally if we can, we'd want to put something under their head. If there are no signs of injury, okay, any severe injuries, no spinal injuries, leg injuries, anything of that nature, you can also put something beneath the person's feet and raise it 6 to 12 inches. Okay, if they are unresponsive, we're going to want to roll that person on his side in this recovery position, okay, that we talked about earlier. And then we will go over later when we are doing our skills assessments, okay? You might have to prevent loss of body heat. You might have to have blankets to cover the person up to keep them warm. If you have not done so already, you need to call 911. We have to remember if somebody is unresponsive, that's an immediate call to 911. You also do not want to give anything to eat or drink. You don't want to do that to anybody that's also responsive until they're completely okay. All right, this can hinder the recovery process and cause more harm. Okay, anaphylaxis. So what do we look for here? Remember, anaphylaxis, like we talked about, is that severe allergic reaction. Okay, so there can be a shortness of breath, swelling of the tongue, mouth, nose, okay, neck, anything along those signs, intense itching, hives, things of that nature, flushed skin or swollen face, sneezing, coughing, wheezing. This may be a sign that their throat is starting to close up, like right here, tightness and swelling in the throat, and then also tightness in the chest. So these are all things that we can look for anaphylaxis. Okay. Also, there can be increased heart rate if we're not able to breathe as much. Our heart's going to start to pump in order to try to get that blood flowing, oxygen. Cyanosis, remember that's the pale blue skin, dizziness, history of a previous severe allergic reaction. So if you know that that person's allergic to something, some type of medication or not, something along those signs. And then obviously medical identification tags. We've talked about that as well. A lot of the times individuals will have these medical identification tags. Okay. If you suspect that someone is going to go into anaphylaxis, call 911. If you're ever unsure, you call 911. You're going to want to monitor their breathing. Obviously, if the person has an epinephrine auto injector, also called an EpiPen, okay, you are going to want to help administer it, especially if they cannot administer it. okay? If the person can swallow, you can also give them antihistamine. So this is something like Benadryl, okay? This helps with swelling, allergic reactions, things of that nature, okay? So when we're using an EpiPen, and we will practice this in our skills assessment, okay? So if we just look at these pictures, it's pretty self-explanatory and decently easy, okay? So you're gonna find the injection site on the outer mid-thigh. So it's gonna be between the knee and the hip on the outer mid-thigh. Make sure you are feeling around so you're not right on that pant seam, okay? And normally you can administer an EpiPen through decently thin clothing. Okay, so the next thing you're gonna wanna do is remove the safety cap, which is in the back, which this picture has done. Okay, and then you're gonna take the EpiPen, you're gonna push it against the mid-thigh until it clicks. Okay, so you will hear a click. That'll be the needle and the administration of the epinephrine. You're gonna hold it in place for 10 seconds, and then you're gonna pull the auto injector straight out from the leg and rub that area where the injector was for 10 seconds to get that epinephrine in. Okay, again, we will practice this in our skills assessment. Okay, so if you have a mild allergic reaction, which is different than anaphylaxis, however, it can lead to anaphylaxis if it is not treated. Okay, so a mild allergic reaction, someone looks like red, itchy eyes. I don't know if you guys if you have allergies outside or things like that. Say you walk out, it's really, really dry, super windy, maybe your eyes start to get red, they're itchy. So things like sneezing, runny nose. You can also get a rash on the skin, usually on one part of the body, okay? So say you got a bee sting, that area might start to develop a rash on it, or it could look something like hives, okay? What we should do with someone with a mild allergic reaction, we obviously need to help this person, and they can self-administer his or her asthma rescue inhaler. So if they have a rescue inhaler, this is the time that you want to tell them to take that rescue inhaler. You can also give them antihistamine. Okay, this should be a step that you should always give somebody, and make sure after you do both of these, you monitor the individual to make sure it doesn't get any worse, okay? So fainting, what happens if somebody faints, okay? If a person suddenly collapses, okay? We see somebody, they faint, they fall to the floor. The first thing we're gonna wanna do is check for breathing. If breathing stops, we're calling 911 and we're beginning CPR. So we should see a pattern here at this point, okay? Breathing stops, no one's responsive, we're calling 911, giving CPR. Okay, if the person is breathing, we're gonna keep that person flat on his or her back, okay, like we saw in those previous slides. We're gonna monitor their breathing. If the breathing does stop, this is when we would start CPR, okay? If 911 has not been called, which it should already be called, then we call, okay? We're gonna check and treat any injuries that this person may have, and then we can also wipe the person's forehead with a cool, wet cloth, okay? If a person is about to faint, okay, you see somebody, they get pale, you can tell that they're about to faint, you're gonna try to do everything you can to help prevent a hard fall for this person. We don't want someone to faint and then hit their head on the ground and cause a more severe injury, okay? If you feel faint, first thing you should do is lie down, okay, or sit down, all right? You guys have probably all heard to put your head between your knees. That is not something that you wanna do. So we do not place your head between your knees. You can sit down on your bottom and lift your knees up a little bit, okay? Or you can lie down, raise your feet up, or raise your head up a little bit. So that's what you should do if you do feel faint, okay? This is basically nice short chapter, okay? So I want you guys to make sure that you look over it, okay? The quiz will be corresponding directly with this. However, if you guys have any questions, please make sure you let me know, all right? On Wednesday, we will be live Zooming, 8:30 a.m., okay? I think I put the time wrong on your announcements at first, but someone noticed, so I was able to change it. So we'll be meeting at 8:30 a.m. It won't be a super long class, but I wanna make sure we talk about chapters 1 through 7 in case you guys have any questions before your exam. And your exam, again, will be online and be open book, okay? If anybody has any questions in the meantime, please let me know. Otherwise, have a great rest of your day. Bye, guys.